Go.
Go. All right, so we're going to start on the outside and work our way in. So you do need to know the foreleg. This is the foreleg right here. Okay. Now on the foreleg, you need to know the elbow. This is the elbow right here, and then this is the wrist right there. Okay, on the hind leg, you need to know the knee. This is the knee right here, and right here is the ankle. Okay. I think that's what you need to know. Yes. Now, on the outside stomach, if the stomach was still intact, I may ask you what these structures are right here. This is the mammillary papilla, or papillae, because there's more than one of those here. This is the umbilical cord right there. Okay. Now, also on the female pig, I'll expect you to know, okay, the urogenital papilla. That's this area right here, and it basically covers the urogenital opening, which is right there. Okay, everybody see the opening? Okay. And then, of course, you need to know the anus. That's right here underneath the table. Okay, now moving into the inside. Oh, wait, we got to do the mouth. So on the mouth, let's see if I can open her a little bit. Okay, this might be a little bit hard to see with all these videos. Is the hard palate. Okay. Now, in addition to the mouth structures, make sure you know the questions that were pertaining to the mouth in terms of when teeth are formed and can you see them as a baby and all that kind of stuff. I might ask you questions about that. This is the tongue. By association with the hard palate, you should know that in the back of his mouth is the soft palate. This is the tongue, and then on the outside of the pig tongue is where the taste receptors are. Can you guys see that? Mm-hmm. Right here are the taste buds all along the side.
So that's why their tongue looks like that?
Yeah, that's why their tongue looks like that. All right, moving in and down through the oral cavity, we come to the larynx. So this area right here is the larynx that we've cut out. And then we have a nice epiglottis here. This is the epiglottis. This will fold down to cover the glottis. Now, unfortunately, they cut up the esophagus really good. This area right here is the esophagus. Normally, you would cut through that, and that would be on the posterior side of the larynx trachea, okay? And then you could see the opening. So pretend that the esophagus is coming up this way. We would have an opening right here to the esophagus, and then this is the opening to the larynx. Again, this is a beautiful epiglottis. And then in the larynx from the anterior side, that is connected to the trachea, okay? And here we see a beautiful trachea, and we see the C rings of hyaline cartilage. Okay, I think that covers that area. The thymus, most of you guys have chopped through that in order to expose the larynx and the trachea, but for the sake of the practical, I would expect you to know that the thymus is covering this region of the larynx and trachea, and the thyroid would be up here. And this may be parts of the thyroid. It looks more muscle to me than it does thyroid, but the thyroid would be up here. Oh, that might be the thymus right there. Can't tell. All right, moving down into the thoracic cavity, we've got the heart and the lungs right here. So I'd expect you to know the right lung and the left lung, okay? I may ask you about the lobes. There are 3 lobes on each side of the pig, so make sure you can identify the lobes and if they're superior, inferior, and middle. All right, now here is her heart. And for the heart, you have to know the 4 chambers. So we have right atrium, left atrium. Oh, it's hard to see. Right atrium, left atrium, right ventricle, left ventricle. All right, now let's see if we can see some of these vessels. She's tiny, so she might be hard to see all of these vessels. All right. Right there is her aorta. See her aorta? And then right here is her superior vena cava or anterior vena cava, this one that's coming into the right atrium. And we've had trouble seeing the posterior this morning. Nope, it's right there. And there's the posterior right behind it. Okay. So the posterior is directly behind it right there. This is the superior vena cava right there. Okay. Yeah. Oh wait, that's the posterior right here. Posterior is down here. And then right up here is the superior. That's been cut. Right here. Superior or anterior, posterior is right here. Coming up from the bottom of the... Okay. Now, pericardium is the sac that covers it. Her pericardium has been completely removed. Oh, there's a little bit of it. So this is the covering right here of the heart. That's the pericardium. Over here. Got it? Okay, now moving down, we need to find the diaphragm. And we got some of it right here. So this is the diaphragm right here. This is the muscle that divides the thoracic cavity from the abdominal cavity. Okay. Here's your liver. Need to know your liver. And we also need to find the gallbladder. And the gallbladder is a sac-like structure, and hers is right there. This is her gallbladder. Okay. Now, moving down, there's the lesser omentum right there. Okay. It's kind of beautiful. And then here's her stomach. And then behind the stomach is the pancreas, and that's right here. Okay, see the pancreas right there? It's that glandular tissue. And then here's the spleen. That's this kind of flimsy piece. Yeah. Now for the intestines, again, we can't tell where the duodenum and all that is. Oh, I guess right here would be the duodenum. But right here you can feel it as a hard region. That's the pyloric sphincter of the stomach. Okay, so that's the pyloric sphincter. That would be the duodenum right there, which is connected to the rest of the small intestines right here. And then this darker green one, thicker in nature, this is your large intestine right there. Okay? Now behind the intestines is the kidney. Okay, and I'm going to show you the one on the right side. Remember, your kidneys have a right and left, people, so make sure you put that on the practical. So this is the right kidney, and I just cleaned out her ureter. Let me find it. It's right here. So this tube-like structure, I know it's hard to tell because she's a little bit juicy right now, is her ureter. Trying to get my, there it is. Okay, that's her ureter right there. Connects the kidney to the bladder. Since we're talking about the bladder right now, we can do that. This is her bladder right here that's been cut. Okay. And then since this is a female, her reproductive structures are right down here by the kidney. So what we're looking at here is this coiled like tube is her uterine horn. She's got a right and a left uterine horn. Here's her ovaries. Okay. And then her uterine body of the uterus is where these two connect, and it's really tiny. And it's right there. Okay. See, it's right here. Where they connect. She's got a very narrow one, but there it is. I'm trying to pull it out for you. This is her uterine body. All right. And did I go through everything? I think that's it for the female. I can't think of anything else. Anybody check me? Guess not.
All right. Okay. Hold on one time. No, you're